Children often develop constipation as a result of stool withholding. They may withhold stool because they are stressed about potty training, are embarrassed to use a public bathroom, do not want to interrupt playtime, or are fearful of having a painful or unpleasant bowel movement. Delaying a bowel movement causes stool to become hard, dry, and difficult to pass, sometimes resulting in a large mass of stool in the rectum called a fecal impaction. Stool builds up behind the impaction and may unexpectedly leak, soiling a child's underwear. Parents often mistake the soiling as a sign of diarrhea. Other causes of constipation in children include a low-fiber diet, certain medications or drugs such as antacids, opiates, and antidepressants, diseases such as Hirschsprung disease, diabetes, and Down syndrome, anatomic abnormalities such as birth defect. Symptoms of constipation in children include fewer bowel movements than usual, posture that indicates the child is withholding stool, such as standing on tiptoes and then rocking back on the heels of the feet, clenching buttocks muscles, and other unusual dance-like behaviors. Parents often mistake such postures as attempts to push, abdominal pain and cramping, painful or difficult bowel movements, hard, dry, or large stools, and stool in the child's underwear. A child should see a doctor if symptoms of constipation last for more than 2 weeks. A child should see a doctor sooner if the constipation is accompanied by one or more symptoms that may indicate a more serious health problem, including fever, vomiting, blood in the stool, a swollen abdomen, weight loss, or painful cracks in the skin around the anus called anal fissures, and intestine coming out of the anus called rectal prolapse. The doctor will ask questions about the child's history of symptoms and will perform a physical examination. The doctor may perform a rectal exam by inserting a gloved finger into the child's anus to check for anatomical abnormalities and for the presence of a infection. Constipation is treated by changing diet, taking laxatives, and adopting healthy bowel habits. Treatment depends on the child's age and the severity of the problem. Dietary changes include eating more high-fiber foods such as whole grains, fruits, and vegetables. Laxatives are frequently used to clear a fecal impaction and sometimes to restore regular bowel movements. A doctor should be consulted before giving a laxative to a child. Parents should encourage their child to spend time on the toilet after meals and when their child shows signs of withholding stool. A child should be seen again by a doctor if treatment fails, or if the child begins to show symptoms that suggest a more serious health problem. You can find more useful information about Ayurveda at www.ayurvedhealthcare.com now.